Hi, everyone, and welcome to the webinar on the CMRITO Standards of Practice. My name is Carrie Brew, and I'm the Quality Assurance Professional Practice Director at CMRITO. I am also a registrant at the college in the specialty of nuclear medicine. And thank you so much for joining us today. We're looking forward to reviewing Standard 2 with you today to support understanding and compliance with the standards as it relates to equipment and materials.
And hi, my name is Johnny Choi, Quality Assurance and Professional Practice Manager. I am also a registrant under the specialty of Diagnostic Medical Sonography. In this webinar, we'll be reviewing Standards 2, Equipment and Materials. Let's begin today's webinar by reading the college's land acknowledgement. So the work of CMRITO, our registrant and system partners, takes place on traditional Indigenous territories across the land currently called Ontario. We are thankful to the First Nations peoples, Inuit, and Métis from across Turtle Island who have stewarded these territories since time immemorial and continue to contribute to the strength of communities across the land today. We are grateful to have the opportunity to live, work, and play on this land. Ontario is home to vast traditional territory of the Anishinaabe, Cree, Oji-Cree, Haudenosaunee, Delaware, and Algonquin peoples, and includes 46 historical treaties, 207 reserves held by 127 of the 128 First Nations of the province, and a portion of the Métis Nation homeland. The name Ontario is derived from the Haudenosaunee word Kanadario, which translates to sparkling water. We invite you to begin or deepen your own reconciliation journey by learning more about the Indigenous people of your area. Let's review our goals for today's session. First, we're going to take a closer look at Standard 2, which focuses on equipment and materials. Next, we'll work on understanding your accountabilities as a medical radiation and imaging technologist, or MRIT. We'll also apply these standards in some case scenarios, and as well, we will identify the resources CMRITO provides to support your practice. And so by the end of this session, you should feel more confident in recognizing the risks and accountabilities with regards to equipment and materials. I'll now pass it on to Carrie.
Great, thanks, Johnny. Let's start the discussion today by taking a brief moment to do a high-level overview of the CMRITO Standards of Practice. If any of you joined us for our last webinar on Standard 1, this will all be very familiar to you. So the standards exist to clearly outline the expectations for safe, competent, and ethical practice and form the foundation of professional practice for all MRT and DMS professionals in Ontario. They help ensure that every registrant, regardless of specialty or years of experience, provides care that protects the public, supports patient safety, and maintains professional accountability. They also give the public a transparent understanding of what they can expect from medical radiation and imaging technologists under their care. The standards of practice, it provides a framework for the college's practice expectations. The publication also includes the MRIT scope of practice and the controlled acts authorized to MRITs. There are 8 standards in the standards of practice, and today we're going to be discussing Standard 2, Equipment and Materials. You can visit our website for webinars on other standards. I previously mentioned we just released a webinar on Standard 1, so please feel free to visit our website to access these resources as you need. And we'll share more information on where you can find these resources later in the presentation today. There are 3 overarching expectations in the standards of practice that form the foundation of safe, ethical, and professional care. The first is related to competence. So registrants must be competent, which means having the knowledge, skills, and judgment needed to practice safely, effectively, and ethically. Maintaining competence is an ongoing responsibility. So registrants must stay current in their area of practice. And if we find ourselves in a situation where we're not competent to perform a task or procedure, we must not proceed. Instead, we're expected to take appropriate action to address the situation and address any gaps in competence before proceeding. The second expectation is related to accountability. Registrants must be accountable, and this means taking responsibility for our decisions and actions, whether those actions are taken independently or as part of a team. Registrants are expected to act based on their clinical judgment and always in the best interest of the patient. And if they believe that a procedure or treatment plan is unsafe, for example, contraindicated or not in the patient's best interest, they must not carry it out. Instead, we or they must take appropriate steps to address the concern. So accountability includes recognizing when patient interests are being compromised and responding appropriately to safeguard those interests. And finally, registrants are expected to be collaborative. MRITs are part of an interprofessional care team and must work effectively with other members of the healthcare team to support the best possible outcomes for patients. This includes communicating clearly, coordinating care, and sharing relevant information. When there are gaps in care or differences in clinical judgment, registrants are responsible for taking appropriate action to resolve those issues and ensure continuity and safety in patient care. So in summary, competence, accountability, and collaboration are core expectations that underpin all of the standards of practice. So now I'm going to hand it back over to Johnny, who will take you through a closer look at the format and structure of the standards of practice with a specific focus on standard 2. So back over to you, Johnny.
Thanks, Carrie. The standards of practice is laid out into 8 different sections: legislation, standards and ethics, equipment and materials, diagnostic and therapeutic procedures, safe practice, relationships with patients, professional relationships, records and reporting, and continuing competence. In this webinar, we will be focusing on Standard 2, equipment and materials. In the standards of practice document, each standard is arranged in the same format. We start with a brief introduction to describe the background and overview of the standard. Next, the practice standard statement is presented. This is then followed by indicators, which provide more specific actions and requirements that registrants must partake and adhere to in order to meet the standard. Let's dive deeper into Standard 2. We begin with the introduction that describes the practice of registrants, that we use a wide range of equipment and materials. Registrants also must know and understand the functions, capabilities, specifications, and hazards of the equipment and the materials they use in their practice. Next, we have the practice standard statement, which states that registrants must have the knowledge, skills, and judgment to select the appropriate equipment and materials for procedures ordered by authorized health professionals to make determinations on the quality, serviceability, and operability of the equipment and materials. Registrants must also take any corrective actions to meet standards set by legislation, facility policies, and manufacturers' guidelines. Registrants must also be skilled in making safe, efficient, and effective use of the resources to produce the desired examination information or deliver safe, effective treatment. Below the standard, we have the indicators, and they indicate the application of the practice standard in a specific dimension of practice. This set of indicators refer to tasks that are common to all registrants. So as listed, registrants must ensure the room is prepared for the procedure specified in the order, select and set up the equipment and materials needed for the procedure specified in the order, select the correct substances to be administered orally by injection or inhalation or into the body through an orifice, prepare diagnostic or therapeutic substances as required, conduct the required quality control tests or ensure that the required quality control tests have been conducted on each piece of equipment and any materials used in the ordered procedure according to the applicable legislation and the facility policies and manufacturers' guidelines. Registrants must ensure that the results of quality control tests are acceptable. If quality control tests are not within acceptable limits, take corrective actions to ensure that the standards set by legislation, facility policies, and manufacturers' guidelines are met. Registrants must also determine the quality, serviceability, and operability of the equipment and materials to be used in the procedure in accordance with the standards set by legislation, facility policies, and manufacturers' guidelines. And if the standards are not met, take corrective actions. Registrants must determine, set, and verify the technique and protocol to be used in the procedure, verify all required immobilization and or beam modification devices as required for the practice, and make use of appropriate shielding devices as necessary for the practice. In this section, there are indicators that refer to activities generally performed only by registrants practicing in specific specialties. As you can see, there are listed under separate headings. This style of organizing indicators by specialties also exists in other parts of the standards of practice. So specifically here, registrants practicing in the specialty of radiation therapy must prepare or construct immobilization or personalized devices and or B modification devices as required. Next, registrants practicing in the specialty of magnetic resonance must administer and follow the necessary safety precautions for entry to the magnet room. Registrants practicing in the specialties of nuclear medicine and radiation therapy must dispose of expired, unused, or contaminated elute radioactive materials and all administrative devices in accordance with legislation and established safety protocols, and store radiopharmaceuticals and radioactive materials according to manufacturer's specifications. Registrants practicing in the specialty of diagnostic medical sonography must clean and or reprocess transducers or ensure that transducers are cleaned and or reprocessed after each patient use in accordance with the manufacturer's guidelines and other applicable guidelines and facility policies. And use, store, and dispose of ultrasound gel and gel containers in accordance with applicable guidelines and facility policies. It's also important to remember that these are additional indicators for the specific specialties, but we mustn't forget about the indicators that were mentioned previously, which apply to all registrants. Okay, now I'll pass it on back to Carrie.
Perfect. So now that Johnny has taken you through an overview of Standard 2 and the associated indicators, let's unpack these responsibilities in a bit more detail. Standard 2 equipment and materials focuses on accountabilities around several key areas, including expectations related to procedure and environmental preparation, ensuring any equipment or material being used is in proper working condition and has met all quality control checks, as well as responsibilities to take corrective action when any issues related to equipment or materials are identified. So let's look first at procedure preparation. MRITs are expected to be prepared for any procedure they perform. So this includes ensuring the room is ready for the patient. So for example, when I'm preparing for a patient for a nuclear medicine procedure, I make sure the room is clean and free from obstacles so the patient can easily enter the room. Equipment and materials are properly sanitized. Any necessary supportive devices are ready to help the patient onto the imaging table, like a stool or transfer boards if needed. A clean sheet is on the imaging table for the patient, and all positioning or mobilization devices are ready. I set up the imaging parameters on the camera in accordance with my department protocol for the given requisition and verify that everything is entered accurately. I have my radiopharmaceutical dose drawn up, calibrated, properly labeled. I've ensured that all quality control performed on the radiopharmaceutical has passed. I do this all to ensure safe, effective, and efficient care. Now, the example I provided was for preparing for a nuclear medicine procedure, but just take a moment to think about what this might look like in your practice. The steps you take to ensure the room and materials are prepared for the ordered procedures. These are things that you likely do every day without giving much thought to, but they all contribute to safe, efficient, and effective care.
Now, for infection and prevention and control, there are more related indicators in Standard 4, safe practice. However, cleaning and disinfection of equipment is part of preparing the equipment for the procedure. It is also part of determining the quality and safety of using the same equipment and to ensure that the risk of infection is minimized from one patient to the next. As we have mentioned, there are specific indicators for DMS to ensure that cleaning and reprocessing of transducers are conducted appropriately in accordance with facility procedures and or manufacturer's instructions. As well, these DMS specific indicators ensure the proper use, storage, and disposal of ultrasound gel and gel containers in adherence to facility procedures and IPAC guidelines. Okay, back to you, Carrie.
Thanks, Johnny. So standard 2 also outlines the expectations for quality control and safe handling of equipment and materials. As Johnny shared earlier, registrants use a wide range of equipment and materials, and in your practice, you must know and understand the functions, capabilities, specifications, and hazards of each piece of equipment or material you use, and also be able to identify and take action when something goes wrong or you get unexpected results. And while it's recognized that you may not be the person conducting the daily, monthly, quarterly, or annual quality control checks on the equipment and materials, you must at minimum verify that it has been done and that it's acceptable. If it's not acceptable, you must take appropriate corrective action before using the equipment. And as Johnny highlighted in the previous slide, Standard 2 has indicators that apply to registrants practicing in a specific specialty. Here, I'm highlighting standards that are specific to the practice of nuclear medicine and radiation therapy, as it pertains specifically to the handling of nuclear substances. There is an expectation that registrants handling nuclear substances store and dispose of expired or unused radioactive materials or contaminated equipment in accordance with legislation and established safety protocols at the facility. And building on the previous slide, in addition to performing or verifying that the appropriate quality control tests have been performed, MRITs are also accountable for determining the quality, serviceability, and operability of equipment at all times. So even though something has passed the daily QC checks, if something malfunctions at any other point in the day, it is the MRIT's responsibility to identify the issue, mitigate risk, and take the appropriate corrective actions in accordance with your facility procedures and protocols and or manufacturer guidelines to correct the issue. A specialty-specific indicator in Standard 2 related to risk management is indicator M, which is administer and follow the necessary safety precautions for entry to the magnet room. So MRI equipment poses significant risk of harm if proper safety precautions and screening are not followed prior to entry to the magnet room. So it is incumbent on the technologist to administer and follow the necessary safety precautions for this environment, specifically to ensure that the safety of all those in their care. It's difficult to look at our standards in isolation, as they really are all interconnected. And while Standard 2 focuses on equipment and materials, you will find related indicators to our topics today in other standards. For example, in Standard 4, I think Johnny already made reference to that, and Standard 7 as well. So Standard 4 safe practice further outlines requirements related to conducting quality control tests and taking corrective action if the tests do not fall within acceptable limits. It also speaks to safe use of substances and safe use of equipment. Most notably and relevant to our discussion today is that MRITs must take all reasonable precautions to ensure that no equipment can injure a patient. Standard 7, records and reporting, outlines the requirements for recording results of quality control tests and reporting any equipment faults or problems. Right back, I'll send it back over to you now, Johnny, to talk about some common pitfalls.
Thanks, Carrie. There are a few common pitfalls or misconceptions that may lead to risks pertaining to the equipment and materials used in the practice of an MRIT. So one of them, important ones to keep in mind, is that it is everyone's responsibility, both the employer, supervisors, and the employees, to ensure that the equipment and materials used in practice meet the quality, serviceability, and operability standards set by legislation, facility policies, and manufacturers' guidelines. And if the standards are not met, take corrective action. It can be risky if everyone assumes it is someone else's problem. Another potential risk is skipping the quality checks prior to using the equipment. So while most of the time we are cognizant of the major equipment QC or set of procedures, we may be neglectful of the smaller materials or consumables such as ultrasound gel, contrast media, medication, etc. So especially in a high-paced, busy environment, it is important to ensure that the practices of ensuring the quality of equipment and materials are consistently met for every procedure. This also applies to cleaning practices and to ensure that tasks to prevent the spread of infection is met. And lastly, it's important to remember to maintain documentation and records for equipment and materials, which includes service and maintenance logs, equipment issues, inventory of consumables, reprocessing records, etc. These are important components that are also addressed in Standard 7, Records and Reporting, and maintaining documentation and records will assist in supporting the quality, serviceability, and operability standards of your equipment and materials. Okay, let's take a look at some practice scenarios that pertain to Standard 2. So our first scenario here is we have, I noticed that the ultrasound probe is cracked. What should I do? So right away, our first thought would be to determine the quality, serviceability, and operability of the equipment. And that pertains to indicator H. Now, depending on when this was noticed, there are also considerations that relate to other indicators, such as if this issue was discovered as part of the pre-check before the examination. In any case, if it is determined that the transducer is at risk to patient safety and image quality, corrective action must be taken. So this also relates to practice standard 4, indicator I, that registrants must take all reasonable precautions to ensure that no equipment can injure a patient. Another point to consider for ultrasound probes would be the cleaning and reprocessing component. And if the transducer is cracked, there would be further equipment potential damage when reprocessing, and even if whether or not it can meet the requirements of high-level disinfection. Okay, Carrie, I'll pass it back to you.
Thanks, Johnny. So the next scenario is, I found expired materials in the storage area. What should I do? So if you identify expired materials in your inventory, the standards of practice require you to refrain from using them and take appropriate action. While we are discussing Standard 2 today, Standard 4, Indicator D, requires registrants to use substances only before their expiry time or date. And Standard 2 requires registrants to determine the quality, serviceability, and operability of materials to be used in the procedure in accordance with manufacturer guidelines. And considering infection control and patient safety, expired items could pose a risk in that they could lose their sterility or effectiveness, increasing the risk of infection, or they may compromise care. In this scenario, appropriate action could include removing the materials from active stock or storage areas and segregating them in accordance with your facility policies and procedures, identifying the scope of the issue, so inspecting the surrounding inventory, looking for other expired items of the same type or batch, determining if this is an isolated issue or a broader stock management problem. Also consider reporting and documenting, notify your supervisor or departmental lead, inform materials management or the supply chain, document the findings. So incident report, if it's required by policy, for example, might be another potential step. You could take corrective, or you should take corrective or preventative action. You may need to ensure proper disposal according to facility policy. You may also want to review stock rotation practices. So for example, first in, first out, and establish regular expiry date checks. And again, these are just a few examples of actions that can be taken when expired materials are noted.
Okay, our next scenario we have here is the equipment malfunctions in the middle of the exam. What should I do? So prior to this occurrence, we would hope that the appropriate preventative steps are taken, and this would be in reference to indicator F to ensure that the results of the quality control tests are acceptable. Now, regardless of the severity of the problem, it is always important to take all reasonable precautions to ensure that no equipment can injure a patient, and this pertains to Standard 4, Indicator I. Because an issue was discovered, MRITs now must take the necessary corrective action. This could range from restarting the equipment to using different equipment or asking a colleague for help. The corrective action would be defined by the facility protocol or manufacturer's guidelines, depending on the issue. It's also important to record and report any equipment faults or problems, as mentioned in Standard 7, Indicator B, and this would help to prevent future equipment failures or perhaps changes to the quality control tests to avoid this problem from reoccurring. Okay, I'll pass it back to you, Carrie.
Thanks, Johnny. So this is our final scenario for the day. And so this scenario is, can I discontinue routine lead shielding based on the updated Safety Code 35 guidance on shielding practices? Okay, so as you may be aware, in 2024, Health Canada published a revised version of Safety Code 35, which replaces the previous Safety Code published in 2008. This revision included specific updates on patient shielding for X-ray procedures. As a result, and based on recommendations from other associations and experts in this area, facilities may be looking to update their policies and protocols to align with the updated safety code. The standards of practice do make reference to the use of shielding, as you can see on the screen in a number of places. However, please note the qualifiers associated with each. So appropriate or as required and where indicated, for example. So each facility's radiation protection officer is responsible for matters related to the safe operation of X-ray equipment under the Healing Arts Radiation Protection Act, or the HARP Act. And the departmental policies and procedures of your place of employment determine what radiation protection devices are required for each procedure. So these policies and procedures will dictate when shielding is appropriate, required, or indicated, while also considering patient needs. The important piece here is that registrants are then required to comply with facility policies related to shielding. So if your facility determined through policy that shielding was no longer needed for certain procedures, you would be permitted to discontinue use of shielding for those procedures in accordance with your facility policies and procedures. On the flip side, if your facility determines that shielding is required for certain procedures or in specific circumstances, then you would be expected to follow or comply with those policies. And that brings us to the end of our practice scenarios. I hope you found those cases helpful. We're going to wrap up today with a few key takeaways. Equipment safety equals patient safety. We work with complex equipment and technology that can harm patients if not used correctly. So as registrants, we're responsible for the safe operation and use of equipment. We must know and understand the functions, capabilities, specifications, and hazards of the equipment we use in our daily practice and take action when necessary. We are accountable for the proper use and safe operation of the equipment. This is not just the responsibility of the employer. If there is ever any doubt, stop using the equipment or materials, assess the functionality or quality, report, and of course, you can always consult appropriate documents like facility policies, procedures, manufacturer guidelines, legislation, and the CMRITO standards of practice for direction and guidance. And last but not least, CMRITO has a number of publications and other resources to support your practice. All of these are accessible through the resource section of the CMRITO website. Here you'll find access to all of our publications, including the standards of practice, the code of ethics, our series of what you must know about practice guides, our newsletter insights, and much more. And similarly, you can access our videos and webinar recordings from here, as well as quick links to the acts, regulations, policies, and bylaws that govern your practices in MRIT and the jurisprudence course. In addition to these resources, CMRITO's professional practice team includes a number of experienced practice advisors representing multiple specialties that can assist you with your practice questions and direct you to the appropriate resources to support your practice where needed. You can call or email us anytime, and we'll share our contact information on screen momentarily, which brings us to the end of our webinar. So with that, I would like to thank you for joining us today. We hope this was a good refresher of your professional accountabilities related to equipment and materials. You are welcome to visit our website or contact us at any time with your questions. Our contact information is up on the screen. Again, we hope you found this webinar helpful. You can revisit this webinar anytime on demand on the CMRITO website, where you can find a variety of other webinar recordings to support your practice. Thanks again, everyone, for joining us today. Have a great day.